I want to talk about something which I'm from Ghana, so basically I'm doing it for, and I want to talk about the topic which I call hypertrophic cardiomyopathy. And the first question that I want to put across is, what is cardiomyopathy in the first place? So when we talk about cardiomyopathy, these are disorders of the heart's muscles. So this is where the heart muscles thickens, so it makes it hypertrophic. And one of the things that I had found in my practice as an advanced clinical practitioner is that this is especially with blacks. I don't tend to find a hypertrophic myopathy. Predominantly, I think it affects blacks more than the whites. And it's a worry, because one of the things is that majority of blacks have a lot of high blood pressure, which doesn't give them any sort of specific warning. So someone can walk with over 200 high blood pressure and will not even have any sign. And as you tend to have persistent high blood pressure, that means that the muscles of the heart is just working and working and working and working. So this causes it to thicken. And then when you do an ECG, you tend to find ventricular hypertrophy, which sometimes shows. So once you see the ventricular hypertrophies, you get to know that there is a likelihood that this person have hypertrophy or something of that sort. And one of the things with hypertrophic cardiomyopathy is that these are genetic disorders, predominantly genetic. So one of the things that I encourage people, especially from African background who have got high blood pressure, is to get an echocardiogram to see what their heart is doing, especially when they have high blood pressure and the ECG shows some hypertrophy, and also to get genetic testing. And for 2025, one of the pleas that I want to plead on my platform is that I want to encourage anybody in the ages of from 40s that we have 3 quarters in a year, okay? So you take January, get a blood pressure machine, check your blood pressure in January, check your blood pressure in April, check your blood pressure in June, check it in September. So set sort of like a 3-monthly boundary and check your blood pressure, because if you don't check your blood pressure, especially if you are from black ethnic background, if you don't take care, it will cause chronic kidney disease. It will lead to a whole lot of complications. And I just want all of us to look after ourselves, because blood pressure is a major killer, and it does a lot of, and the complications with cardiomyopathy is that it leads to heart failure, it leads to irregular heartbeat, and it leads to sudden death. So let's take care of ourselves, and God bless everyone.